Good afternoon, everyone. My name is Amanda Godley, and I'm the Vice Provost for Graduate Studies and a professor in the School of Education. Welcome to the University of Pittsburgh. I am so pleased that you chose Pitt for your graduate career. Our graduate and professional students make up about a third of the students on the Pittsburgh campus, and so you're very important to the strength and identity of the University of Pittsburgh, and we're so glad to have you here. I want to begin by respectfully acknowledging that the University of Pittsburgh stands on the traditional ancestral lands of many indigenous nations, including the Osage, Monongahela, Delaware, and Shawnee nations. The process of knowing and acknowledging the land that we stand on, physically or virtually, is a way of honoring and expressing gratitude for the Native people who are on this land before us and the rich history of the place in which we're learning. At Pitt, it's our goal to not only make your graduate school experience as fulfilling and exceptional as possible, but also to prepare you to make an impact on the world beyond the university. Pitt's core mission is to improve the world through knowledge. And so we take seriously our charge to both help you gain that knowledge and to think about how you can use it to make a positive impact on the world. Our graduate students are currently helping to improve the world in various ways, including participating in research on public health and COVID-19, making scientific advances in fields like engineering, computer science, and business, providing understandings of current events from the perspectives of the humanities and social sciences, and engaging in research and conversations about equity and social justice, both in the United States and across the globe. A core value of Pitt is diversity and inclusion. It's essential to us that everyone feels welcomed and valued at the university. As you start your graduate or professional program, I also want you to know that we are committed to supporting you holistically. That means not only providing you with excellent classroom and academic experiences, but also supporting your endeavors and life outside of academics. In a few minutes, you'll get an overview of these supports, activities, and opportunities from various campus leaders. And as you know, this orientation and our resource fair were originally planned for in-person. Although we're having orientation here online right now, and our resource fairs will take place over the fall term, the graduate and professional student welcome picnic this afternoon is still taking place in person from 4:30 to 6:30 p.m. outside on the Posvar patio. You are all welcome, and I hope to see you there. Before I turn this event over to other campus leaders, I wanted to say a few words about the fall term. You're likely aware that the COVID-19 pandemic remains a fluid situation and has led to some adjustments to the first 2 weeks of the term. Most graduate and professional programs are beginning the fall term in person as planned, but some have chosen to begin the term with remote options for instructors and students. If you're unsure what your program has planned, please contact your program director or administrator. They will have the answers for you. And if you have an appointment as a teaching assistant or teaching fellow for an undergraduate class, you may also have the flexibility to teach remotely for the first 2 weeks of the term. Again, contact your program administrator if you have any questions about that. Most other campus activities will continue as planned for the next 2 weeks, including research labs, field placements, practicum experiences, and lab classes. And I know you're going to hear this a lot and maybe already have for the past couple of days, but I want to stress the importance of getting vaccinated against COVID-19 and uploading your proof of vaccination to the University of Pittsburgh's Student Health Portal. Uploading your vaccine documentation is easy and will release you from things like mandatory testing or quarantining. So if you haven't yet uploaded your proof of vaccination, do it today. Information is available on the University of Pittsburgh website and if you log in through the Pitt portal. If you have any questions about the fall term, vaccines, or anything else, please post your questions using the question answer feature on your screen. We've reserved the last 15 minutes of this orientation to answer your questions. I want to end by saying that we recognize the amazing step you've already accomplished by starting your graduate or professional program. And we're thrilled to welcome you here to Pitt. We're eager to see all that you're going to accomplish both here and beyond. So now it is my pleasure to introduce to you our Vice Provost for Student Affairs, Kenyon Bonner, and our Dean of Students, Carla Panzella.
Hi, folks. Can you all see me? Carla, can you see me? All right. Andy, can you see the presentation? All right.
I can see you.
All right. Well, it's good to see everyone. Welcome to Pitt, first and foremost. As Dr. Godley said, I serve as the Vice Provost for Student Affairs. My pronouns are he, him, and his. First, I want to thank Dr. Godley and the graduate team, Jen Walker, Callan Rowe, and Stephanie Hugendorn for planning today's orientation, and also our graduate and professional student government board for their role in supporting graduate students and representing all of your interests and needs. As Dr. Godley said, I serve in this capacity. Carla Panzella, I'll introduce you in a second, serves as our Dean of Students on the Pittsburgh campus. And my primary role is to provide strategic leadership to help us best support our graduate and professional students. I want to say congratulations on your new beginning, this exciting chapter in your lives, being accepted to a graduate or professional program at the University of Pittsburgh. That's a huge achievement. So first and foremost, congratulations. Second, I just want to welcome you to the Pitt community and let you know that we are here to support you, and we will be happy and proud to see you thrive and be successful while you're with us during the time of your graduate studies. So without further ado, I want to introduce our Dean of Students, Dr. Carla Panzella. Her role is important. She's here to support students both at the undergraduate, graduate, and professional level. And I'm happy to hand off the rest of the presentation to Dr. Panzella, your Dean of Students.
Good afternoon. As Dr. Bonner said, I'm incredibly honored to serve as your new Dean of Students. And like many of you, oh, they put that photo up, I just noticed it. Like many of you, I'm also new to Pitt. I assumed this role just a few short weeks ago, and I'm still learning Pitt's acronyms and building names. Finding veterinarians for puppies. Thank you, Dr. Godley. You've been very helpful. And learning how to drive around Pittsburgh without a GPS. I have to say, I can get to work without my GPS. Don't throw anything in between, but I can get here from home to GPS. It's a lot of transition. And I imagine that many of you are also managing a host of life transitions, perhaps housing, work and career responsibilities, family and pet needs, logistics of daily life, even as you're preparing to embark on a challenging new graduate or professional program, right? These are big transitions individually, certainly compounded makes them more challenging. As with any major life transition, there are many times when you may doubt yourself, or times when you wonder, why are you here? Imposter syndrome is real, and we all have it at moments. And many of us, faculty, administration, the like, have experienced that feeling as well, as I just said. But let me reassure you that we believe you have all the skills necessary to be successful at Pitt. We have chosen you because we know you're ready for the challenge. We believe that you belong here. We also believe that the strengths you have to offer will enhance our community and will promote our shared enterprise of seeking and sharing knowledge, as Dr. Godley said earlier. We believe that the diversity of perspectives, life experiences, and backgrounds you represent will enrich this community, and we value that diversity. So you belong here, and we're here to support you as you achieve your professional and academic goals. To that end, we encourage you to get involved in the life of this community, of the Pitt community. Get involved in activities on campus. It's a great way to cultivate in yourself and others a sense of belonging. And that's the role of student affairs at Pitt. We provide programs and services for students, both graduate and undergraduate. So hold on to your socks, because I'm going to walk through quite a bit of some of our programs and services we have I just want to highlight some of them. You'll find a whole host on our website, and come over to the to the union anytime to see us, but here's a few highlights. Student Affairs provides enhanced, we're here to help you with your physical, emotional, and mental well-being, that's for sure. So let's see the slide. University Counseling Center, they call it UCC. We should remember that, I'm working on it. And they're here to support you. This is a season of uncertainty and stress for many of us. Please continue to take care of yourself and your mental health. Check in with your mental health professional if you think you can use some support. If you're interested in engaging in UCC services or seeking support for the first time, please utilize the virtual drop-in services by contacting the phone numbers there, Monday through Friday, 9 a.m. to 4 p.m. for personalized care plans. Services are free and confidential. They offer individual and group counseling as well as therapy assistance online or TAO. We have psychiatric services, wellness workshops on topics such as resiliency, huge topic right now, right? Managing anxiety and stress, and the healing from the trauma of racial injustice. The UCC also offers 24/7 crisis response by calling the phone number. I'm just making sure crisis response is also up there. Jot those things down, put them in your phone, save them, just in case you need them at any point for yourself or a friend. Student health services, you'll have, you might be inundated with health information regarding COVID-19, but I want to remind you that the student health services is here for you for regular health needs as well, not just COVID-19. Our student health services is fully accredited, providing high quality care for all students. Services include primary medical care for acute and chronic conditions, women's health care and contraceptive care, men's health care, LGBTQIA healthcare, including transgender care, psychiatric services, orthopedic care, and sports medicine and physical therapy. Quite a bit. One very important service that SHS, Student Health Services, provides is immunization. It is important to the health and the well-being of all the students, faculty, and staff at Pitt that we protect ourselves and our community through immunization, particularly COVID-19 vaccine. You're going to hear us saying this over and over again. If you have not already done so, please upload your COVID-19 vaccine card on the Student Health Services website. We'll drop the link in the chat so you can easily find it. We take your health very seriously. We want you to feel your best so you can do your best in your academic and professional programs of study. Holistic well-being has a measurable impact on academic and professional success, and we know that. Student success also provides many opportunities for volunteer services and community engagement. Pitt Serves. Through the Office of Pitt Serves, we encourage you to serve with Pitt students on the signature days of service, including our Civic Action Week in October, Martin Luther King Jr. Day of Service, and Be a Good Neighbor Day. You can also connect with nonprofit organizations and track your service hours at volunteer.pitt.edu. Pitt Pantry is a food pantry that is open to all students to gain access to healthy food options and personal care items. And Thriftburg, love that name, is a campus thrift shop where you can trade in clothes for credit, all while helping build sustainability on campus. The University of Pittsburgh is committed to supporting all students in meeting basic needs, including access to adequate food, safe housing, and other necessities. Basic needs security supports students' physically and mentally, academic performance, and professional development. Founded in 2020, the university's Basic Needs Committee was formed to ensure that all students have access to clean air and water, food, housing, clothing, and hygiene, healthcare, technology, academic and career success services, and transportation, while continuing to address systematic barriers and disparities in access to these resources. If you need assistance with basic needs, please contact my office at deanofstudents@pitt.edu. The Student Emergency Assistance Fund was created during the pandemic to address emergency student needs. Any student may apply once for up to $600 to help with emergency expenses that meet certain criteria. For more information on the fund, you can contact my office as well. Finally, we also encourage you to have fun exploring the arts and cultural opportunities offered in Pittsburgh. And I'm discovering this too. It's pretty exciting. Pitt Arts is a unique program at Pitt that encourages undergraduate and graduate students to participate in the rich cultural life of the city. Through Pitt Arts, you have free entry to museums using your Pitt ID, pretty awesome. Access to the Cheap Seats program, which provides reduced tickets to ballet, concerts, theater, music, and musicals, and graduate and professional student arts encounters. For more information, visit studentaffairs.pitt.edu/PittArts/good. It's up there. You can cut and paste or take a look at that and copy it. As always, Student Affairs is here to serve you, our graduate and professional students, to enhance your time at Pitt. Please reach out at any time. Let us know more about the graduate and professional experience. I want to hear about that. I'm new here, and I want to really learn firsthand from your new experiences. So if you have thoughts, concerns, if you just want to share your experiences, please reach me at deanofstudents@pitt.edu. Welcome, Panther Nation.
Thank you very much, Dr. Panzella and Dr. Bonner. It is my pleasure now to introduce the president of the Graduate and Professional Student Government, Morgan Pierce. Welcome, Morgan.
Thank you. Can you all hear me okay? Fantastic. So hello all, I'm Morgan Pierce. I am the president of the Graduate and Professional Student Government. I am a third year PhD student in the Department of History in the Dietrich School of Arts and Sciences. I want to welcome you to Pitt, and today I'm going to take about 5 minutes to tell you a little bit about the Graduate and Professional Student Government, who we are, what we do, our travel and conference grants, and how you can get more involved on campus. So who are we? We are an organization on Pitt's campus made up of all graduate and professional students. We are the governing body of graduate and professional students at Pitt, and by your position as a student, you are automatically a member of GPSG. So that means you can participate in any of our events, attend any of our meetings, and apply for any of the grants that we offer. We have an executive board of 4 vice presidents and 1 president. And then an assembly board made up of representatives of the governments of each school. So for example, my school, Arts and Sciences, has its own student government, and they send a representative every month to our assembly board meetings. Those meetings are open to all students, so you can feel free to attend. They are governmental meetings designed to address the issues that are relevant to our graduate and professional student population. So we're here to serve you and to advocate for graduate student interests. The GPSG is really the middleman between the entire graduate population and our administrators. We really help our administrators keep a pulse on what graduate students are saying, and we try to give you whatever resources that we possibly can to make your graduate experience better. So, with that said, we're here to serve you, so please feel free to reach out to any executive board member at any time. I'll list my email in the chat in just a moment, so you'll have that. There are a lot of other things that we offer our graduate students: travel and conference grants and advocacy and professional development grants. You can check those out at this link. Those, again, are available to all students and are a way that we support you guys. We also appoint students to university level committees so that you have a voice. If you're interested in serving, you can fill out this link and we will try to get you placed on a committee or get you more involved. And then we also plan and hold events for our grad students throughout the year that are more social in nature. So the first one is our Welcome Back Happy Hour at Southern Tier this Friday. And I am happy and sad at the same time to announce that that event has sold out. So unfortunately, you can't buy a ticket, but you can always sign up for our next event, which will be a Wellness Coffee Hour on September 10th. For more info, you can either sign up for our newsletter or follow our social media. So you can check those things out here. And then again, I just want to say, if you have any issues, any questions, any concerns, or you just want to be more involved, you can reach out to us anytime, either at gpsg@pitt.edu or to me directly at president.gpsg@pitt.edu, and I will drop those both in the link as well. Again, I want to welcome you to Pitt. Thank you all, and hail to Pitt.
Thank you, Morgan. And to everyone on this call, I very strongly recommend that you get involved with GPSG, whether it's on the social side, getting grants, getting involved, all of the above. It's a great place for graduate professional students to gather, get to know each other, and share ideas and activities. So the next speaker we have is Katie Pope, who is the Associate Vice Chancellor of Civil Rights in Title IX. She will be talking about the Office of Equity, Diversity, and Inclusion and Civil Rights and Title IX issues. Welcome.
Thank you so much. I'm just going to take a minute and hopefully get my screen shared appropriately here. I realized my error in not being at my desk in some time is that I'm not used to sharing my screen with double screens anymore. So it takes me just a moment to get reacclimated. So I do apologize for that. Hello. There we go. Okay. Hopefully everyone can see that. If not, someone let me know. So as Amanda said, I am Katie Pope, Associate Vice Chancellor for Civil Rights and Title IX with the Office of Equity, Diversity, and Inclusion. My pronouns are she, her, and I'm very glad to have an opportunity to talk with you all today. Welcome to the University of Pittsburgh. My role is to let folks know about the work that we do in OEDI. And our mission is to coordinate and expand the university's longstanding commitment to equity, diversity, and inclusion across the university. Our Vice Chancellor, Dr. Clyde Pickett, who unfortunately is traveling today and wasn't able to join us, but is a wonderful resource and is working very hard to make sure that OEDI serves as a partner and a consultative service to all faculty, staff, and students across campus. So as you begin your time at Pitt, if there are questions that you have or concerns that come up or ways that you'd like to get involved, we hope that you will take a look at OEDI and connect with us, and perhaps we can find ways to help you get connected with the work that's happening here. The three main areas of work that we do here in OEDI revolve around campus climate. So programs to do training and education, for example, ways in which departments can become more digitally accessible, for one example, or ways in which we can make sure that the university community is being more open and welcoming to transgender students or to international students. Another way that we work with the campus is through our Civil Rights and Title IX component, which helps to respond to concerns of harassment and discrimination. And it's here to make sure that if those types of events do occur, that we're addressing them both with the individuals and with the larger systems in which they might have occurred. And then finally, we also work with the campus community through education and celebration. So these can include things like events for Black History Month, as well as training on such topics as our Diversity Inclusion Certificate program or our anti-racism program that's happening, as well as our annual diversity forum that takes place every summer. To give a little bit more detail, we want to talk more about OEDI's role with education and celebrations on campus. So again, we have events, as I have highlighted. We also have a grant program. So if you have an idea for an activity related to perhaps a awareness celebration or an art exhibit related to a certain culture or identity, those are things that you can find out more about on our website, which will be posted at the end of this presentation, and we'd be happy to talk with you more. Again, we have the Diversity Inclusion Certificate program as one of our education offerings. We also offer a number of different trainings and education opportunities, and we're happy to partner with student organizations as well as labs or classrooms. So for those of you who may be teaching this while you're here with us at Pitt, please know that we're always happy to serve as a resource for that. Again, we have our annual diversity forum that takes place every July. Because we've gone virtual for the last 2 years, it's quite a great audience. It's a great opportunity to submit to do a presentation as a proposal for our forum, and gets a broad audience from across the country. This last year, I believe we had about 6,000 people attend from all across the country with, I think, something like 20 different institutions represented in terms of the folks making presentations. So it's a great event. And then we also have our Pitt community groups. So these are affinity groups based around things like veteran status. Some are based around nationality or ethnicity. We have one that is based around disability status. So do consider that if you're looking for a way to expand your connections here at the university. Other ways that we're engaged with the campus community are in incident prevention and education, ongoing climate assessment. So we work with a number of departments to assess concerns about maybe if there's campus climate, or sometimes we just do it as an ongoing feature. Some departments we've worked with for many years, and they want to keep a tab on how open and inclusive their departments are. So we work with them to make sure that we're monitoring that. We also do complaint and incident response. We work on the university's affirmative action plan, which means that we're making sure that recruiting, particularly around faculty and staff positions, is a very accessible, open process. And then we also work very closely with individuals with disabilities. Specifically thinking about this, inclusion is a key priority for the chancellor and for the university, and it's also the law. So under the law, Rehabilitation of the Americans with Disabilities Act make it clear that discrimination based on abilities is unlawful. And it's always important to remember that disability is part of our conversation when we're talking about diversity and inclusion. The Office of Disability Resource Services, DRS, as it's affectionately known here at Pitt, is part of OEDI. And we are here to, DRS is here to make sure that if there is a need for an accommodation, folks, whether it's faculty, staff, or students, have a way and an opportunity to request those accommodations. Just this last year, DRS has brought on a staff member to work specifically with faculty and staff. So that person is a little bit better suited to know some of the resources available. And then the majority of the DRS staff is available to work with students. We have these similar resources on all of our regional campuses. And the key to this is that it is an interactive process. When you first reach out to DRS to register with them and talk with them about possible accommodations, it's going to be an ongoing conversation. It's important to note this because sometimes folks think that maybe if they just fill the form, everything's taken care of. But because we want to make sure that you're receiving the ongoing accommodations that you need, there will be ongoing conversation and an interactive, iterative process between the person requesting those resources and DRS services. So please know that that resource is there and available to all of our community members, and do take advantage of it if you have any kind of ability, concern, or question. Additionally, it's important to note that within the Office of OEDI, part of our role is to make sure that the university is free from all types of discrimination and harassment. So that means that every year we make sure to publish our notice of non-discrimination so that everyone knows that based on protected statuses as identified by federal and state law, that individuals have the right not to experience discrimination and harassment. If you feel at any time that you have experienced any type of discrimination or harassment, or maybe you witnessed it, maybe you're just not quite sure, that's part of why we talk about ourselves as a consultative service. Please feel free to call the OEDI office and talk with one of our staff. We're happy to talk through concerns and questions you may have and help you decide how you want to proceed. Maybe you need assistance, maybe you need accommodation. That's what we're here to help folks understand. Another part of our role is to address Title IX and sexual misconduct. Title IX is federal legislation that protects individuals from any type of discrimination on the basis of sex and gender in education settings. So this applies to faculty, staff, and students. And it's been an important emphasis of Chancellor Gallagher and the university, particularly over the last 6 to 7 years. Our office was expanded in an opportunity to make sure that folks know how to report and what happens when you come forward. So I want to take just a minute and talk about what does occur when someone files a bias incident. So a bias incident is something that is filed whether you experience harassment, discrimination based on sex and gender, race, ethnicity, religion, or any other protected status, as we talked about earlier in the non-discrimination statement. A bias incident can be an action against a person or a group based on that protected class. So for example, if you are walking into the gym to work out, for example, and someone has put some sort of graffiti on a wall that is inappropriate, maybe uses some sort of inappropriate image or language that is offensive, that's something that you should let our office know about. Sometimes an incident can look like interference with an educational work environment. So for example, if a student is preparing to have a child and is told that they aren't able to participate in something because they may be pregnant, that would be something that we would want to know about. It's also important to remember that when you're reporting a bias incident, we're going to talk with you about a few things. It doesn't have to mean that everybody is offended by what happened. If it's something that impacts you and in particular prohibits or reduces your accessibility, then that is an incident that we need to address. Intent versus impact. So what we're concerned about is how you as the person, or if someone who's reporting to us, how they have experienced that incident. And then we also want to remind folks that we are very conscious of free speech issues, particularly in the classroom. Obviously, academic freedom is a keystone of the university. And so this will be something else that's discussed if there is a concern that comes forward. Certainly, we want to be available to have conversations about any concerns that you may have. You will be getting lots of information on how to file a report through Pitt Concern Connection, which is our online system for filing reports at the university. You can do this anonymously and are certainly welcome to do so in that way. We would also encourage you to consider putting your name when you do file a complaint, because when you're able to identify yourself, it gives us more opportunity to follow up with you, make sure that you're safe, make sure that there are any accommodations that you might need, as well as to begin to look at patterns and see how we might be able to assist. I apologize, as I think this slide might be a bit fuzzy, but you can see there's a tab, Report an Incident. If you click there, you'll go directly to the site to report any type of incident. This site is also available on various other pages across the university. And of course, you can always just give our office a call or come in and speak with someone here on the team if you'd rather talk with someone in that way about your concerns. The other thing that we want to make sure folks know and understand is that when you do come to talk with us about a concern, there's no wrong door. The University of Pittsburgh has a responsible reporter role. So all faculty and staff are asked when they receive a report of sexual misconduct, most definitely, and if they receive a report of other types of harassment and discrimination, they are strongly encouraged to bring that information to the Office of Civil Rights and Title IX here in OEDI. So there's no wrong way to report. If you go to a faculty member, if you use the online form, if you come to our office, whatever it might be, all of those reports come through our office. And what we do as we work through those reports is make sure that person who's been affected first and foremost is safe and still has access to their academic and workspace. We discuss with them what concerns and what issues we can address for them. And then we look at how we might address the situation so that the same type of harassment or discrimination doesn't occur a second time. So know that it is, again, an iterative process. There will be conversation. The police are not initially involved. That's something that we ask parties if they want to involve police, depending on what the situation may be. So please know that when you're coming to talk with us, you're not talking with law enforcement. You're talking with the university office, who's here to make sure that university policy is followed and that our students, staff, and faculty have access to their academic and workplace settings and that they're safe. So we want to make sure that you know how we can partner in this space, particularly around civil rights and Title IX. Again, we're here to respond to reports of harassment and discrimination. We can provide education and training, not only on how to report, but what happens when those reports come in. We can customize presentations based on things like microaggressions or working with members of the transgender community, or how best to serve students who may identify as having a disability. We can work with different departments, different student groups, different organizations on addressing climate issues. And as well, we can make sure that if you do need some type of accommodation or assistance to make sure that your education and workspace opportunities are the best for you, that's part of what our office is here to do as well. When a report is made, it's important to know these things. If you report to someone, whether it's a faculty member or another staff member, their role is not to investigate. It's to bring the information to us. And I would encourage everyone to look at this the same way. We want to keep information confidential as possible. Sometimes we do have to share things if someone requests an accommodation, but we make sure that the party reporting knows every step of the way how that's going to be done. It's our role in the Office of Civil Rights and Title IX to treat all parties fairly and not to take sides. And we want to continue to watch the environment so that we make sure ongoing issues are resolved. Retaliation is prohibited. So if you come forward to make a report or participate in any kind of reporting process, know that you are protected from retaliation. And our office is always here if you have any kinds of questions or concerns, or just need to talk through a situation. We just want to remind everybody again, if you leave here with nothing else today, know that from the Office of Equity, Diversity, and Inclusion, and specifically the Office of Civil Rights and Title IX, we're here to respond to your concerns. Pitt will not tolerate violations of harassment and discrimination policies. We're here to listen, we're here to assist, and we're here to help resolve and remedy these situations. So if we can be of any assistance to you, if you have questions or concerns that you would like to discuss with us, or maybe you just aren't sure where to go, we're happy to be that first stop to have a conversation. You can email me at katiepope@pitt.edu, or you can go to our website, diversity.pitt.edu, which will have additional information and talk about all the different events, activities, as well as reporting that are available to you through OEDI. And with that, I will close that out. And if anybody has any questions, I'm looking in the chat quickly. I don't see any directly for me, so I will sign off. Thank you so much.
Thank you. Thank you, Katie. We really appreciate that information. We do have questions that have been answered in the question and answer feature if you want to take a look or if you've asked a question there. And again, we'll have more time at the end of this orientation for questions as well. I would now like to introduce Brittany Turley Fund and Martin Spangenberg from the who will talk to you about graduate student health insurance. Welcome, Brittany and Martin.
Thank you very much. My name is Martin Spangenberg. Can everybody hear me? I'll take that as a yes.
Oh, sorry, I didn't unmute myself. Yes, we can hear you.
That's fine. And Brittany, go ahead and please introduce yourself.
Hi, my name is Brittany. So I work for the Pitt Benefits Department. I'm the analyst that oversees our student health and welfare plans. So if you do have questions, it'll go to my department. And then if anything escalates, it'll come up to me, but I do help oversee those programs. But I'll go ahead and pull up our presentation and then get that started. Give me 1 second. I'm opening up everything else I shouldn't be.
Sorry, I thought about it.
All right, let me hit share here. Where are we at? Okay, share screen. Share. Okay, can everyone see that?
Yes.
All right, so our graduate and professional student health insurance plans. So our student insurance plans are on a plan year of September 1st through August 31st. Your enrollment period is right now. It started August 1st and runs through September 31st. So you do have till the end of September to enroll in our programs. We'll get into a little bit more detail. So first, what is health insurance? It is a contract that requires your health insurer to provide to pay for some or all of your costs in exchange for the premium that you pay on a monthly basis. Your health insurance covers the costs and offers many other important benefits as well. Without insurance, the cost of healthcare can be extremely high. So it is crucial to have your healthcare insurance whenever you do need it. It's better to have it than not need it, than need it and not have it. So for international students, there's no universal or national health insurance in the United States. Medical, dental, and vision insurance is a personal responsibility that you must enroll in. The University of Pittsburgh requires that all international students do purchase and maintain health insurance while you are enrolled. So once you do reach the United States, you are required to either enroll in or attest to other coverage that is US based. It doesn't have to be the university's offered programs, but you do have to have US based insurance in order to be a Pitt student. International students have the option, like I said, to purchase our programs or any other number of US-based insurance providers. You do have the open market that you can research all your options before choosing. But again, you do have till September 31st to do so. All of our student medical plans satisfy the J1 visa holder requirements, so you do not have to worry about any other requirements being met. All of our programs do meet those requirements, so you would be eligible. And then I'll jump over to Martin.
This is the enjoyable part of the presentation, some definitions to some insurance terms. Pretty much everybody knows what a premium is. It's just the amount of money that you pay for your health insurance on a monthly basis. Be aware that you can also pay for the full year if you so choose. Copayment, that's the amount, a specified dollar amount that you pay at the time of service for a certain covered benefit. Not all benefits are covered with a copay. You're expected to pay your copayment at the time of service. It's typically, but not always the case. You may receive a bill later. The deductible, which is different than a copayment, is the initial amount that you must pay each year for covered benefits before the insurance plan begins to pay or begins to kick in. Co-insurance is a percentage of expenses for covered benefits that you are responsible to pay after you meet your deductible. So the co-insurance and deductible work together. Prescription drugs are drugs and medications that by law require a prescription from a doctor that then you can be filled at a pharmacy. Out of network, that's a phrase usually refers to a physician, a hospital, or other healthcare providers who are considered non-participating in an insurance plan. And if they are not out of network, then that would be all responsibility on the member. It would not go through the insurance. Primary care physician, a physician or medical doctor who directly provides or coordinates a range of healthcare services for a patient. Usually your wellness visits are performed by the PCP. You can go to the PCP for certain concerns, who then they may refer you to a specialist, and that would be a physician that specializes in medicine or with groups of specific patients. They help diagnose, manage, prevent, or treat certain types of symptoms and conditions. Anything with an ologist is considered a specialist. Emergency room, that's a department in a hospital that provides immediate treatment for acute life-threatening illnesses or trauma. And then urgent care is a category of a walk-in clinic focusing on delivery of ambulatory care in a dedicated medical facility outside of a hospital, typically outside of a traditional emergency room. Urgent care centers primarily treat injuries or illnesses requiring immediate care, but not serious enough that you have to go to an ER. I just want to go back to the discussion on out of network. The plans do have participating and non-participating plans. And so if it is considered out of network, then it would go through the non-participating part of the health plan, and you would pay more out of pocket than you would if it stays in network, just for clarification. Can you go to the next, please? Now, the graduate student plan and the general student plan are both available to all graduate students. The graduate student plan is available to all academic appointed students, pre-doctoral fellows, and then also those graduate students without an academic appointment. Departments for those with appointments and the pre-doc fellows, there is a stipends that it's agreed upon through those departments. The general student health plan is also available to all the graduate and pre-doc fellow students as well as the graduate students without academic appointment, and then also to the full time undergraduate students. General student plan is less expensive than the graduate plan for those who would be paying out of pocket for the premium. Next slide, please. So the difference between the two plans is the graduate student plan would be considered a very rich plan. They both are very rich in nature, but the graduate student plan has very little out-of-pocket responsibility when it comes to services. As you can see, the specialist, primary care, urgent care, emergency room co-pays, and that's the amount of money that you would pay for those services. Nothing else would be held responsible unless there's some sort of diagnostic testing that follows after you see a primary care physician or a specialist. There are additional costs related to those diagnostic tests. But as you can see, those costs are very low compared to what you would probably have to pay out of pocket if you did not have insurance. It also carries coverage for your pharmacy through the university pharmacy at a lower copay than it does if you went to a retail setting, such as Giant Eagle or Rite Aid, et cetera. And as you can see, it does have out-of-network coverage, but at a lower level. Go ahead. The cost for the plan is pretty much straightforward. Here it is. This is also online, I believe, Brittany, through the UPM, through Pitt's website, and you can see the costs that would be incurred to each student, whether they are a graduate with appointment, a pre-doc, or those without an appointment. And as you can see, you can actually enroll just not yourself, but also family members and dependents. Next one, please. The general student plan, as I said, is not as, it costs a little bit more when you come to out-of-pocket expenses. It's still very low compared to a lot of plans that are out there that you would see on the through healthcare.gov or through Penny in Pennsylvania. Again, the co-pays for the primary care, specialist, urgent, emergency are low in comparison to a lot of other commercial plans that are out there. This is where there is some additional costs, where there is deductible costs involved. And once you reach a deductible of $250, that's where the plan will kick in, so to speak, where the plan pays 90% and then you pay 10% of the costs. An example would be inpatient hospital stay. If you went to if you were to stay at a hospital, you would need to pay the first $250, and then after that, if you have not met your deductible, and then after that, then you would pay 10% of the remaining costs. The plan would pay 90%. Again, there's pharmacy coverage. Costs a little bit more than the graduate plan. With the general plan, it is straight across, whether you go to the university pharmacy or to the retail settings, the cost is the same co-pays. And again, there's a very reasonable cost when it comes to the initial fees that you would have, unless it would be less expensive for you to have the insurance than if you did not have insurance, for sure. Next slide, please. As you can see, the cost of the general student plan is a little bit less than it is the graduate, but again, because the plan itself isn't as rich, it's going to cost you a little bit less. Once again, this plan is available to all students, whether you're a graduate or health science fellow. For those with graduates with academic appointments, you are automatically enrolled in the graduate plan. Next slide, please. To discuss the provider network, you are in Oakland, and you can see that UPMC is is pretty much all over the place wherever you walk. It is a very rich network. As you can see, there are 125 hospitals, just not in Pennsylvania, but in Ohio, in New York and Maryland. There are over 11,000 physicians that are available to you. That would be PCPs, specialists, et cetera. So there would be no concerns for any kind of lack of care. If you are coming from out of state and you do have if you do need some assistance in finding physicians, member services would be there to help you to find physicians within the area, within the Pittsburgh area, for you to access care at the lowest cost for yourself. And also the pharmacy network, again, is quite rich locally, but also it does connect with national chains such as Rite Aid, Walmart, et cetera. For those who are concerned about coverage just outside of Pennsylvania, outside of Pittsburgh, you are covered. There's something called Assist America that comes along with every UPMC health plan member, and it's considered one of the largest providers of global emergency medical services. And this is, again, if you're traveling away about 100 miles away from the local area of Pittsburgh. Typically, though, I always suggest that if you are traveling away from Pittsburgh, and if you're domestic traveling, do call member services, because they are there from 7 to 7 Eastern Standard Time. So you can always call them to find assistance if you need it, if you're away from the Pittsburgh area and need to find a provider, a facility, et cetera. Realize, though, in an emergency, no matter where you are in the world, in the United States or in the world, you're covered at the highest level at every single emergency room. So you don't have to worry about what emergency room you need to go to. In the case of an emergency, go to the emergency room that's closest to you and you will be taken care of at the highest level. Again, I mentioned about Assist America. It works well in the United States, but it works very well in the global international travel. We're not doing a whole lot of that right now, and that's unfortunate. But once things kind of loosen up and we are able to travel a little bit more, and if you are traveling internationally, Assist America is there for you. If you're in a country and you have no idea where to go and what to do, you call Assist America and they will assist you in finding the care that you need. And also for all graduates and general student plan members, there is a national network that's available to you. So when you're away from Pittsburgh, and if you might be returning home, if home is not part of the Pittsburgh area, you have access to a national network called PHCS, and you'll be able to you'll be able to find facilities and providers through that network at the highest level of cost for you. Member services will be able to assist you to find those providers, to find those facilities that you might need when you're away from Pittsburgh and if you're at home during this time. Next slide, please. Nope, that's you.
Yep, back to me. I do see people submitting questions too. Martin and I will be part of the Q&A at the end. So I'll go through some of them just to see if they're more personal, need to be addressed one-on-one, but otherwise we will be part of the Q&A at the end, so we will be able to address questions with you guys at the end. But in addition to our medical coverage, we also do offer dental and vision, so I'll go through those two as well. So we have our dental coverage through United Concordia, which is a division of Highmark. It is available to all graduate students with or without an academic appointment. So our graduate student dental plan highlights, the primary dental office selection is required in the state of Pennsylvania. So you will need to have, it's called a PDO. You will need to have a PDO in the state of PA. And all of your services have to be conducted through that PDO. You cannot go to a specialist without your PDO referring you. So please do select a PDO in the state of Pennsylvania in order for your services to be covered, and then also for any specialists that you need to be referred through that PDO as well. There is no annual deductible or no annual plan maximum on this graduate student dental plan. 100% coverage for exams, cleaning, and x-rays. Reduced member co-payments for crowns, root canals, oral surgery, and fillings. Orthodontic coverage for dependent children up to the age of 19 only dependent children up to 19. And there is in-network benefits only. So again, you do have to be in the Pennsylvania network. So do please check that out to make sure those services and those facilities are in network for you. The pricing here is a little bit different. It is just the student only, the student dependent, and student and 2 or more dependent. So those are the monthly premiums right there for that plan. We also do offer vision coverage. It is through Davis Vision. It is again available to all graduate students with or without an academic appointment, so everyone is eligible. So it has a covered and full annual eye exam, so you can get one eye exam every 12 months. It is to the service date, so you can't go sooner than your service date. Covered in full, also you can get eyeglasses or So you can either get $60 towards your frame allowance towards your frame of choice, or $75 in contact lens allowance. If you do choose the frame each year, you do get your eyeglass lenses covered in full. Additional lens options are available at discounted member prices as well. And there is a 1-year breakage warranty on your plan already included, so you don't have to purchase additional warranties on top of your eyeglasses. The coverage pricings are here as well for the 3 tiers, so that would be your monthly cost for this plan. Just some general provisions to remind you guys of. So like I said, your enrollment period is open now. It started August 1st and it runs through Thursday, September 30th. I do apologize. I think I said September 31st before, but it is September 30th through the end of the month of September. If you elect coverage, your coverage will begin on September 1st, 2021, no matter what date you elected it. So even if you enrolled in coverage on Thursday, September 30th, your coverage would still be retro to September 1st. And your coverage will end on August 31st, 2022. It is a 1-year contract. So you do have it for the 12 full months of the academic year. Unless you experience a life event, such as a qualified status change, like marriage, divorce, birth of a child, this will be your only opportunity to make changes until the next enrollment period, next August, for the September 1st, 2022 effective date. So you can't graduation is not a status change to drop your coverage. So unless you gain coverage elsewhere, this will be your coverage for the next 12 months. International or domestic travel during the plan year also is not an approved life event to terminate coverage. So if you are traveling, you cannot terminate your coverage just due to that as well. As part of the enrollment process, international students are required to attesting to having other coverage based in the US or enrolling in our university-sponsored programs. If you do not enroll or attest by September 30th, a registration hold will be placed on your account for the spring term. So you will not be able to enroll in spring classes until you enroll or attest to other coverage through e-benefits. Students who hold academic appointments should select the $0 payment option for their medical plan. If this is not available, then they should not enroll in health insurance and they need to contact their academic department first. Sometimes the paperwork just might be slow and it might not have transferred over to our e-benefits portal. But if you are an appointed grad and you do not see the $0 payment, do not enroll in coverage until we get that settled. So reach out to your department administrator first, and then we'll assist them in getting your coverage elections updated. So enrollment takes place in the my.pitt.edu portal in the e-benefits portal for enrollment and payment. So you'll log in through your Pitt passport, you'll enter your username and password as normal. Just make sure you're electing the student in the top right corner and not like faculty or staff or something. Search for student health insurance in the search bar. Once you select the student health insurance, you want to pick the one that denotes the e-benefits in the search results and continue through the online enrollment and payment processing part. Payments can be made on a monthly recurring basis via a credit card, debit card, or through checking or savings account. Questions regarding payment should be directed to UPMC member services. Your department and we at the university cannot assist with payment questions, so please do call UPMC directly. Instructions are also available on our website, so if you don't remember how to get to the enrollment window, you can go ahead on our website and find those instructions there. Payment is deducted monthly beginning October 3rd for September 21 coverage. So your payments will be on a month delay. So in October, you're gonna be paying for September. In November, you're gonna be paying for October. So it's always gonna be on the 3rd of the following month for the coverage you just used. If you need assistance, there's 2 routes that you guys can go depending on what you need help with. So the UPMC Health Plan, our member service team, like Martin said, they're available Monday through Friday, 7 a.m. to 7 p.m. and Saturday, 8 a.m. to 3 p.m. Eastern Standard Time. They're a Pitt dedicated team, so they can assist with all questions regarding Pitt coverage, enrollments, payments, medical, pharmacy, benefit needs, anything you guys might have questions on in regards to your student insurance, please contact them. If you want to contact the University Benefits Department, we can help you we can assist you with students who are not able to enroll or have incorrect statuses in the system. Like I said, we'll work with your department administrator to get your status corrected. You are able to call us on our live phone number or submit an online inquiry through a case, and a member of our team will be in touch with you within 24 to 48 hours. We also have all of the information we just presented on our website as well. So if you want to recap anything, all of this plus more is on our website.
Great, Brittany. Thank you so much. And thank you, Martin, as well. There are a lot of questions in the question and answer section of the Zoom. And so we'll be getting to them in just a few minutes. And ones that we can't get to, we'll be sure you have the resources you need to contact the right folks to answer your question. So finally, our last speaker for today, I'd like to introduce Megan Stahl, who's a health educator with the Student Health Services. Welcome, Megan.
Hi, everyone. Thank you for having me. Can everyone hear me okay?
Yes.
All right. I'm going to attempt to screen share. All right. And can everyone see the slides? If not, please let me know and we'll get that fixed. So hi. So yes, I'm Megan Stahl. My pronouns are she, hers. I am from Student Health Service. I'm a health educator in the Office of Health Education and Promotion. Today, I'm just going to give you an overview of Student Health Service. We have a wide variety of different resources that are available to students to support your well-being. I'll be referencing some links, and I'll make sure to drop those into the chat at the end of the content as well, so you have those too. So I do want to make before we go into services, want to make a really quick note on immunization. So all incoming full-time and part-time undergraduate, graduate, and professional students must submit proof of the immunizations for measles, mumps, and rubella, or MMR, or varicella, chickenpox, to Student Health Service. You can upload your vaccination information through the health portal in the Pitt Student Health Portal. If you go through my.pitt.edu rather, there's the Secure Health Portal. That's where you'll upload that information. I have a QR code there. Actually, you can scan to access the website directly if you'd like to see a little more information on the instructions and what's needed for the MMR and varicella vaccination information. As mentioned earlier, having vaccination records is really important because that allows us to provide you better care if there were to be an illness or an accident, campus outbreaks, and things like that. So this information is really valuable for us to have. And you can find information there on our website on how to do those uploads. As mentioned previously too, the COVID-19 vaccine, very valuable to have that information as well. So there is a step to upload it into the health portal. So we have that information. It's listed on the screen. You can also find it on our main student health website. There's a little block that gives you the instructions on that. But again, you'll want to upload a copy of that card and enter in those vaccine dates on at your health portal. So we have that information for you. And again, this information is really important to support the health and safety of our campus community, as well as if there is an exposure that you've had relating to COVID, that gives us some information to help figure out how best to care for you as well. So check out the website for information on how to do those uploads. Regarding the COVID vaccine, so the Pitt COVAX Vaccination Center is where you can get those COVID-19 vaccines. They do have walk-in appointments that are available. It's open to the public, I believe, actually. You can pre-register for appointments. So if you visit the RAS bit.ly link right there and use the access code Panthers, you should be able to pre-register for an appointment slot if you prefer. For any questions or assistance, you can call the vaccine hotline, which is the 383-4372. They're listed on the page. That vaccine clinic is actually located at 4140 Fifth Avenue. So it's on the first floor of Nordenberg Hall, beside PNC Bank or across from Starbucks if you're trying to locate it. So you can get your COVID vaccines there. They have all three that are available. Additionally, if there were to be a situation where if you have symptoms or you believe you might have been in close contact or exposed to someone with COVID-19, please contact Student Health at the 412-383-1800 for information on testing and treatment. They do ask that you don't just arrive at Student Health. They want you to call in advance so they can guide you through how to get connected to testing and give you some information based on your circumstances. And again, to learn more about the university's response and the most up-to-date information regarding COVID-19 policies and information, you can look at coronavirus.pitt.edu. Now, as far as where the Wellness Center is located, so we are across from Starbucks beside Soldiers and Sailors or a catty corner from the Union. So we're located at University Place on the corner of 5th and University Place. There's actually 2 entryways and 2 floors, depending on what you're accessing. So the second floor is home of the Counseling Center and Student Health Service. The entry for that is the corner closest to the University Club. So that's the yellow arrow on the screen. That's how you enter to access the second floor for student health and counseling. The first floor is where the pharmacy is located. They actually have a separate entry. So their entry is on the corner of 5th and University Place, which is the blue arrow on the screen. That's how you would enter into there. As far as student health service, we actually have kind of 3 areas under us. So we do have the student health, like the medical clinic available. We have the health education promotion office, which is where I work. And we also have the university pharmacy. We are staffed by a number of highly trained professionals, a number of different people with a lot of different backgrounds and specialties. And we are very dedicated to supporting our students, providing the highest level of care to support your well-being here while you're a student. I do want to note that student health is also accredited by the Accreditation Association for Ambulatory Healthcare as well. As far as what we provide, I know this was reviewed briefly at the start of the program, but we have a number of different services. So we do offer primary care for both acute and chronic conditions. We can do things like physical exams, preventative care, including age-appropriate screenings. We have reproductive health care, which includes gynecologic services like annual exams, pap smears, contraceptive care like IUD insertion. Those are all things that we can provide. We also have LGBTQIA+ services, including gender affirming care that's available. We offer the travel assessments, pre-travel health assessments are available. We can do allergy injections. We have sports medicine, STI testing and treatment, a lot of different services and support for our students. If it is something that we cannot do on site, so for example, if you need referred to PT, we can assist in getting you connected to services in the community as well. Student health does offer a number of different vaccines. Again, the COVID-19 vaccine is not one we actually offer in student health. We would refer you to the Pitt COVAX Vaccination Center, but a number of other vaccinations we do have available, including the flu vaccine, MMR, and others. So if you have any questions about vaccines, you can always give us a call. We'd be happy to give you additional information or direct you. Additionally, we do have both telehealth and in-person appointments that are available at this time for students. As far as our hours, we're Monday through Friday, 9 to 5. During the regular academic term, we have extended hours on certain evenings until 7 p.m. In the fall, it'll be Monday and Thursday evenings. Additionally, we do have 10 to 3 available in fall and springs on Saturdays. Currently, as of today, at least, everything's by appointment. So you want to make sure to call to set up an appointment to come to be seen in. You can contact our number there to answer any questions about scheduling or services that you might have. And again, we do have the telehealth and in-person appointments that are available. For the most up-to-date information, you can always contact us or check our website as well, and we'll be happy to assist. As far as insurance information, so student health does accept medical insurances. We accept most major providers at this point. If you do have a question about insurance coverage, you can always contact us or your insurance provider. We'd be happy to assist. Additionally, you can also upload your you can't upload a COVID thing, your insurance copy. You can actually upload that information to the health portal. So we have it on file if you'd like as well. And you can find information on our website on how to do that as well. The pharmacy service is actually open not just to students, faculty, staff, and the community. Anybody from the public can actually utilize the pharmacy. And they have a number of different services in addition to prescriptions. We have a lot of over-the-counter medications and supplies. You can actually order those, the OTC items, at least online in advance. We have an ordering system that we use for that. So you can order online and pick it up from the pharmacy, which is fantastic. We have a number of trained staff to answer any medication questions you might have. There's also the Pocket Prescription or Pocket RX app that's available for Android and Apple iOS. Check that. It's a great way to connect with pharmacy to ask questions, to refill prescriptions, and it makes it really easy. It's a fantastic newer service that we have. Additionally, there is a medication disposal box on site. So if you have outdated or unused medications that you're trying to figure out how to dispose of, that is available in the lobby area there as well. For any questions from the pharmacy, you can always, again, message them through the Pocket RX app, but you can always call them at the 412-383-1850 website as well. Health education has quite a few things to offer. Our regular business hours are like an 8:30 to 5, though we do have some services depending on the area that'll extend into the evening. So for example, our dietitian does one evening a week, and Stress Free Zone does have some hours that extend in the evening. You can visit our website for the most up-to-date information on services, but I'm going to give you just an overview of all that we have in here as well. So we do have a quit cessation program. That's one-on-one nicotine cessation counseling that's available for students. So it is only for nicotine products, but it can be cigarettes, chew tobacco, e-cigarettes, and whatnot. That is totally free for students. You can contact us by email and we'll coordinate scheduling. In addition to the one-on-one meetings, we do have an optional free nicotine replacement service that we can offer if you're in our program. That's through our pharmacies. So if you have questions or like more information, please contact us. We'd love to help students work on becoming nicotine free and working on those goals as well. We have a registered dietitian. She offers a number of different services. She has a lot of different specialties she can work with, anything from just general eating to sports nutrition, specialty diets, navigating the dining services even, in terms of what might be some of your goals or needs in terms of diets or nutrition. So she has free one-on-one appointments that she can offer students. Additionally, she does offer some group programs that are available as well. For information or to schedule, you can contact Student Health and they'll get you connected with her as well. And then the Stress Free Zone, that's actually not in the Wellness Center, that is on the 3rd floor of the William Pitt Union. So Hallie does a number of different workshops. She has a lot of services available to students. They are returning to in-person services this year. So you are able to go in. Their services this year, the walk-in services will be Monday through Thursday, 11 a.m. to 8 p.m. and Fridays, 11 a.m. to 3 p.m. In addition to the in-person services, they have virtual workshops that they offer. And this is just a really great place for students to go where they can learn more about and practice evidence-based mindfulness practices, stress reduction skills, and things like that. So anything from biofeedback and mindfulness stations, yoga classes. She does mindfulness walks and a lot of other things. And this is open not only to undergraduate, but also graduate and professional students as well. We have a number of different prevention and outreach workshops and programs that we do throughout the year. So anything from Alcohol Awareness Week, we have substance-free and stress-free events that we coordinate either through us or that we collaborate throughout the year as well that we look forward to bringing back this year. In particular, we have our Healthy You Fair, which will be Wednesday, September 29th. That's from 10 to 2. William Pitt Union Lawn. Rain location is inside the Union. This is actually their kickoff to our vaccine clinic for the flu. You can get your free flu shot here with your Pitt ID. So we encourage students to come out. We have a number of different departments and entities from the community to share different resources and information on health and wellness aspects that are available for students to utilize. So we hope that you'll check us out or come see us. You can also follow us on our Instagram and Facebook at Pitt Healthy U to find more information, not only on programs and events and services, but also just some general wellness information that we share as well. And then finally, we do have a collegiate recovery program. So that is a student support service. We offer one-on-one meetings to connect with students to further support the recovery goals. I do want to note that this is not intended for treatment or counseling. It's just an additional support service for students who are in recovery. Additionally, we do offer different substance-free programs and events during the year as well. So we hope to add some additional programs throughout the year as it goes on, including some additional trainings. We're currently working on a recovery ally training, for example, that we hope to launch later this year too. So there's a lot of opportunity to get involved, either if someone's in recovery or wants to support others in recovery. We'll be expanding and introducing some new services and events this year too. So you can email us at shsohep@pitt.edu for any questions relating to health education, and we'd be happy to help. And again, there's our contact information. So, and I will be around for the Q&A to answer any questions as well if needed.
Thank you, Megan. There's one question that came up a few times in the question and answer, so I thought I would just go ahead and ask you that now. And that is, are the services through the Student Health Center all free for graduate and professional students, even if they don't have Pitt insurance?
Okay, there. So I'm just bringing up everything. So student health bills to insurance, if you do not want to use your insurance provider or don't have insurance, they do offer self-pay, but you'll want to contact them to discuss the prices. It's going to vary depending on what's offered. So if you have any questions about what is covered, what the costs are, I would recommend contacting Student Health. We do bill to insurance, but I know sometimes students may not have insurance or may not prefer to use it for some reason. Contact student health to discuss what the cost might be to use those services.
Thank you. There was also a question about access to the University Counseling Center. And I don't know if perhaps Dr. Bonner would like to answer that, or someone else could talk about graduate and professional students' access to those services as well.
Sure. How about I do? I think Dr. Bonner had to hop off the call. So students are able to access counseling services. It is free for students, and they can also access the TAO service online, which is a online access to services. And there's group counseling, individual personalized counseling, but they are able to access counseling for free.
Great, thank you very much. And I also saw a question in here about whether it is less expensive to get your prescriptions filled through the university pharmacy or through a commercial pharmacy like CVS or Walgreens. My hunch is it depends on what your insurance is, but I wonder if someone could provide a more definitive answer than I can.
Well, I'll just jump in real quick. There is a difference between the graduate plan and the general plan, as you stated. There is a bit of a difference. The graduate plan, there are lower costs, lower co-pays compared to the general. If you're not getting insurance and you choose to use a discount card of sorts, that I cannot talk about because the pricing is different from pharmacy to pharmacy.
Great, thank you. And I will say, just for everyone who's kind of wondering about prescriptions, that I myself use the university pharmacy, and the staff there is so helpful. So I'm sure they will answer questions like this for you as well. They are incredibly helpful and generous with their time. We have quite a few questions about health insurance. And Martin, I don't know if you've had a chance to look at them in the question and answer, or if I should.
Yeah, if you don't mind, I haven't had a chance to look at the questions. I'm sorry.
I've been trying to answer as many as possible. I've been
Thank you, Brittany. Do you want to talk through some of them? Would that be
absolutely
more useful or for folks? I think there are questions about whether graduate and professional students can sign up for the university health insurance after September, or what the deadline is.
So after September 30th, the only way you can sign up for insurance is if you experience a qualified status change. So if you lost medical, dental, vision elsewhere, just anything, any qualified status change would be the only reason you can enroll in our coverage after September 30th. So this is your only opportunity otherwise to enroll in coverage. So if you didn't want something, like I saw a question that someone didn't want dental until December. If you want dental and aren't losing it between now and December, this is your only opportunity to enroll in dental.
Great, thank you very much. And another question that arose is whether or not a dependent of a graduate student can enroll for the general student insurance.
Yes.
Okay.
Go ahead, Martin.
I was going to say, somebody's enrolling in the graduate plan and they want to enroll a dependent in the general plan. Is that to my understanding?
I'm not entirely sure. So I think maybe answer as best as you can with some clarification. If
I will do that. Yeah. If one is enrolling in the graduate plan, you can then enroll dependents in the graduate plan. You cannot enroll dependents in the general plan, and vice versa. If you're enrolled in the general plan, you cannot then enroll dependents in the graduate plan. It's a family. The family needs to be on the same plan.
And this student would need to be enrolled too. So you can't buy coverage for just your dependents and not yourself. It would have to be yourself and your dependents.
And this is related to another question, which I don't know whether or not you got a chance to answer, is whether or not there's COBRA for student health insurance.
Some plans, and Martin, you can speak to them a little bit more if you want to, but some plans are eligible for COBRA coverage, some are not. It also depends on your appointment status or not. So if you did have very specific questions on your situation, feel free to reach out to us or UPMC to advise. Martin, do you have anything?
I was going to say our COBRA would be available through those who have academic appointment, fellowship, but as a non-appointed graduate student or a general student who is picking up insurance, there would be no COBRA available to that individual.
Great, thank you. There were a couple of questions about dental insurance. One was whether or not as a graduate student you can just sign up for dental or vision insurance and not university offered student health insurance. And the other question was about the School of Dental Medicine. I wonder if anyone could talk a bit about the services that they offer.
So our plans are cafeteria plans, so you can pick and choose whatever you want to enroll in. If you only want dental, if you only want vision, if you want all three, you can enroll in whatever you choose to enroll in. But again, this is your only opportunity to enroll in any of those three unless you experience a qualified status change. And then I know Martin might have a little bit more on it, but, or actually no, Martin, you might not. But University Dental School is included in our United Concordia network. So if you did want to utilize the dental school, they are participatory. I can't say that word. They do participate in our plan. So if you did want to seek them out for services, you are eligible to do so.
Great, thank you. And I'm going to shift slightly to answer a question that came up about assistance with writing for graduate and professional students. I do want to be sure folks know that the University Writing Center is open to graduate and professional students as well as undergraduates. So if you would like writing assistance, I would suggest that you contact them and sign up as soon as possible. And I'll put the link in the chat right now. So I've noticed a few questions about parking and we've answered them, but I just want to say generally that parking on campus is tight. There are not a lot of lots, and that it's really helpful to know that your University of Pittsburgh ID gives you free bus. It basically operates as a free bus pass throughout the city. You can even take the inclines up and down the hills for free. And so a lot of people, myself included, take the bus instead of driving to campus. Some people park further away from campus where parking is free and then take the bus from there, just maybe 5 or 10 minutes. So you can go to the university's parking website, which we posted, but we also encourage you to seek alternate ways and using public transportation. The other thing that I would mention is that the city also has public bikes that are available called Healthy Ride. And with your Pitt ID, you can sign up to get free 30 minutes rides on the bikes. So, if for instance, you park 10 or 15 minutes away, you could park near one of the bike stations and ride the bike for free to the university and leave it here at one of the stations. So that's another option for commuting. There was a question, again, I'm talking and fielding questions at the same time. Let me first answer one that just came in about public transportation. Is it safe after 9 p.m.? I would say yes. I take public transportation late. I think most people would say the same. Of course, it can depend on exactly where you're going, but I think that's something that your faculty or other students who've been here for longer can give you good advice about. Carla, are there other options for for transportation around campus and kind of safety late at night?
Yeah, so I'm new, folks, so I'm still learning a little bit about all those pieces, but I do see shuttles around campus. I think someone just dropped it in the chat. Thank you. And you'll see that there are scooters now, and we have mixed feelings about the scooters, folks. We want you to be really careful on the roads with the scooters. And then safety, of course. I think I just met with the chief of police yesterday, and I do believe that in Oakland and around campus is extremely safe, and folks could contact police if they want to walk along or feel like they have any challenges there. I would encourage everyone to download the Rave Guardian app so that you can they can guide your walk. You can say where you're going and time it, and they would be alerted if they need you. Excuse me, if you need them in a quick moment. So I would all download that and see all the resources around safety that they have to offer for you pretty immediately.
Thank you. I wanted to see if Morgan might reiterate something she put in the chat about ways that graduate and professional students can get involved in campus organizations and activities. Morgan, would you be willing to say a couple words about that?
Yeah, absolutely. Pitt has a really vibrant graduate and professional community. We have a lot of organizations on campus. So I posted those when I answered one of the questions, and I'll repost them in the chat in just a moment. So there are listings on the Student Affairs website, as well as it's the website essentially that all of our student organizations are listed and do their governance structure stuff through. So you can look those up. You can join any of them. I imagine this year there's going to be a lot of events that are available both digitally and in person. I know all of our assembly board meetings will be available to attend in person if that's safe, and will be virtual regardless of our COVID status. So we want to do that to offer access to students who may not be able to attend for any reason. So I imagine that a lot of organizations around campus are going to do that as well. And I will post those links now. I do also want to say the bus system is great in the city. There are a couple of apps that track the buses. Those will be your lifesaver, very safe. Every student on campus will tell you that it makes way more fiscal sense and way more time sense to deal with the buses than it does to try to have a car. So.
Thank you. I agree. The bus system is terrific. There were a few questions about errors with the e-benefits system, trying to log in. Is there any guidance that someone could give for receiving an error message when trying to log into e-benefits?
Yes, I was actually just addressing a couple of those and wanted to point this out. So if you are getting errors on your enrollment, if you're an appointed grad, please contact your department first. It could mean one of two things. It's usually that your status has been updated correctly, so your paperwork just might not have gone through yet. So please start with your academic department first to make sure that that part is squared away. If you are getting another error, the most common one, it's error code some LZ. It most likely has to do with your address. If you do not have your mailing and home address updated correctly with the registrar's office, you will not be able to access e-benefits because we need active addresses for you to enroll in our coverage. So please go onto the registrar's office. They do have a self-submission form that you can update your address. So please do that first. If you are still getting that error after 24 hours, contact the benefits department and we'll be able to work with your department and e-benefits to get those errors corrected.
Thank you. And Megan, I know that you are trying to respond to various questions at once, but this question was raised twice, so I wonder if you might answer it live. And that's whether incoming graduate students who are also undergraduates at the University of Pittsburgh need to resubmit their immunization records, including proof of vaccination for COVID vaccination.
I would recommend contacting student health directly because they'll be able to actually pull up your information to see if they have everything they need, if something's out of date, if it's been entered correctly. So any questions about vaccine records, coverage or anything like that, you contact student health at the 412-383-1800. Our front desk staff will be able to assist you with more direct questions regarding your records or your situation.
Great, thank you. And I noticed that we are 1 minute over. There are still a few more questions to answer, but I hope that for those questions, you know where to go now if we haven't answered them directly, whether you contact your department or the student health services, or you can always contact my office at vpgodley@pitt.edu. I'm putting it in the chat right now. And we will make sure if we can't answer your question, that it'll go to someone who can. And so I wanted to end today's orientation by saying, thank you all for attending. Thanks to the Graduate Studies team who worked so hard on this, and to all our panelists for giving us your time and your expertise. And I want to end by saying we still have the Graduate and Professional Student Welcome Picnic, which will take place from 4:30 to 6:30 today. It's okay if you didn't RSVP, just come on out and join us. There's going to be music, there's going to be games. The Provost is coming by, or activities. The Provost is coming.
I think we may have just lost VP Godley, but we are going to have a great picnic this afternoon. I hope everyone comes out. You will get to experience finding parking firsthand, or the buses if you need to do that. Jen or Callan, is there anything else that we need to close out with?
I don't think so. We're just looking forward to having you all at the picnic if you're able to make it. Thank you.
I think that's great. Also, GPSG will be handing out a couple of prizes, so it's more incentive for you guys to come. Thank you all for being here today, and welcome to the University of Pittsburgh. Hail to Pitt.